If we think about it, the world we know now runs basically on collaborative work. Collaboration doesn't just make things easier for the professionals, it also ensures the quality of the service or product that they give to their customers or patients. Having many brains work together just seems like the smarter choice to make in this day and age. For this video, I've asked various professionals of their thoughts on collaborative work and their experiences on collaborative patient management. The following were the questions asked. Doc Jerry has shared that he has previously worked with other healthcare professionals. Being an ENT surgeon, he made sure to be in good communication with his patients' other physicians in order to address all their symptoms and treat them the best that he can on his end. Some of these specialists he's worked with are dentists, pediatricians, oncologists, and neurologists. He has also mentioned that he often works closely with dentists and that he thought that this would be the same case in the future as well. Nurse Judith currently works as a company nurse at Lexmark but also has extensive experience in working abroad as a hospital nurse. Through years of employment, she shared that she too has worked with dentists. She emphasizes the importance of good communication amongst healthcare professionals, as any rash decision could be detrimental to the patient's prognosis. Lieutenant Osman Nogra earned his Doctor of Medicine degree from the Uniformed Services University of the Health Sciences in the USA. He's now honored to be able to serve in the military community as a family medicine physician. He stated that he too has worked alongside dentists numerous times and has often referred patients to first receive dental care. He has mentioned that aside from referrals, he had also worked alongside dentists during medical missions both in the military and civilian settings. He agrees as well that in order for one to be in optimum health, one has to firmly take into consideration their oral health. He admits that though he's had limited dental training, he's confident that his patients' oral health will still be well taken care of as he has a multidisciplinary team which includes a dentist. Nurse Glenn is also based and works in the United States. He more so specializes in wound care, particularly on the elderly people. He mentioned that though the elderly have many increasing concerns health-wise, dental care has always been one of the top priorities they look out for. Throughout his career, he's worked with countless other professionals to tend to the needs of his patients, dentists being one of the most frequent ones. He explained that having good oral health just lessens the chances of potential ailments or diseases from happening. Worst case scenario on what could happen to patients with poor oral health could be loss of masticulatory function, which could lead to poor oral food intake, loss of appetite, weight loss, depression, and which leads to neglect and death. Diversity is what really makes this world a better place, a concept that can be applied to many things and can be interpreted in many ways as well. In healthcare, diversity just means having a broader scope of knowledge and more sources of information, which equates to a better chance of good diagnosis and treatment. Every option would have its pros and cons. Opting to collaborate with other specialists does indeed have its cons, but as said by these knowledgeable individuals, having good communication amongst the other specialists still outweighs those concerns. Some notable concerns were conflicting schedules, varied workflows, differing perspectives. It takes time and people come from different educational backgrounds. They said that it might not be the easiest thing to explain or work with people that didn't necessarily study the same material or field as you, which again just makes it harder and lengthens the whole process of diagnosis and holds off the treatment. But just as there are challenges, there are also advantages to this whole concept. Having different specialists around you just exposes you to diverse opinions, perspectives, and communities. It helps hone critical thinking skills that's really beneficial when it comes to working with a team. It also aids in nurturing respect and solid communication within the said community. You can always rely on these people when you're in need of their specialty or opinion. Although working with various specialists might result in a longer diagnosis and treatment plan, there's also a big possibility that this can help the dentist shorten that said process. It's like he or she is delegating this task to professionals that are skilled in that certain field. This also ensures that the best treatment would be provided as everyone has had a hand throughout this process and can confidently proceed without any worries. After hearing these professionals, I've come to the conclusion that it really is beneficial to have a widespread network of various health specialists. Not only does it lessen the workload of the dentist, it's also time efficient, lesser chances of burnout, and also ensures that the best treatment and service would be given to the patient in need. One shouldn't hesitate to refer or ask for help, as this just benefits the dentist and their patients in the long run. Though there are some challenges in this approach, we believe that the advantages outweighs these said disadvantages. It's always good to look out for one another, even if those people are specialized individuals already. Strong bonds could also help lead to a longer, healthier career as well.